Welcome to Challenge Chat's new episode, new year, and I couldn't be more excited. And of course, for our wonderful opener today, we're joined by Mel as always. Hello, Mel.
Hi.
New year, new podcast. Isn't that exciting? It's survived a year.
It's very exciting. It's 2023 and we're ready to go.
It's so crazy. I still can't believe that it's actually 2023. Honestly, spring semesters are coming up. We have the Crystal Owl Gala, which will be so exciting. I guess we'll have to talk about that maybe next podcast or so.
Yeah.
And then, of course, we just had our Commitment to Community Service Award close. And by the time this podcast comes out, we'll be deep into that process of picking a winner and talking about that more and all that kind of jazz. That'll be so exciting. And of course, Student of the Year, one of our biggest competitions that'll be closing soon. And Mel, I know you wanted to talk a little bit about that because it's super exciting and coming to an end here.
Yeah, there's about a month left to enter our Student of the Year competition, and we want all of our students out there listening in our participating schools to enter that. You can win up to $1,500, and that's a check. It's not a scholarship, so you can use that for anything you want. We'll have 10 finalists in total. 7 will be semi-finalists and get a little bit of cash. 3 will be finalists and get a lot of cash. And 1 will be a winner, and that's who gets the $1,500. So there's a good chance that you could get picked if you enter.
And that's always so exciting. Of course, the more people that we have enter, we always love going through them. So many great stories. So make sure to take your time and really put a lot of energy into your application for that.
Yeah.
And now, of course, this episode, we're super excited. We'll be flashing over to past Bryce, who is interviewing Miss Addison from Penn Highlands Healthcare. She's a super exciting person that we work with over there. She's the student outreach coordinator for them. And we just talk a lot about both the healthcare field, and we talk a lot about opportunities for students and people just in general to work within the healthcare field. And of course, we talk about stuff like their job shadowing, the way that they job shadow with students, the way that they work with students through school to both work there and go to school at the same time, and so many other things, including just good advice for students who are just going into college or the workforce just in general. So it's super exciting. I know you've talked to Addison a little bit, Mel, so I know that you were super excited for this interview as well.
Yeah, Addison is great. Penn Highlands Healthcare is great, and I'm pretty sure that they're interested in paying for some of the students' tuition to go into healthcare if they plan on working for them in the future. So that's a great benefit.
Yeah, they have the 2 big things that I'm excited for, and you guys will hear more about it in the interview, but I just want to mention it even before the interview just to put into your thoughts, is first they have a program where they help pay for your schooling while you're working with them, and second, in that program, they allow you to transfer between hospitals while you work there. So if you live near one hospital and then in the future get interested in moving into another area where they have another hospital, you can move to that area, keep your job, keep your tuition and everything, which I think is just so exciting, and that's very useful and a very unique experience that most places do not give you. And I just wanted to voice that to everybody because whenever I heard that, I was like, oh my gosh, that's so amazing. So definitely listen to the interview and get the information about that. And in the description below, we do have a lot of the information for Addison because she said that if any students are interested or if you just have questions or concerns about any of the stuff that we talk about in the podcast, she's more than happy for you to reach out and speak to her personally. So I'm so excited for all of that. I know that Mel's super excited. Any other thoughts before we go to the interview, Mel?
No, I think just enjoy, and we'll talk to you after.
Yeah, we'll see you afterwards. Okay, now over to you, Past Bryce. Okay, everybody, so now today I am with Addison McAninch from Penn Highlands Healthcare, the Student Outreach Coordinator. How are you doing today, Addison?
Good, thanks. How are you?
Good. So we're interviewing you today just a little bit, both to get to know Penn Highlands Healthcare and to know just a little bit more about you. So first, just tell us a little snippet about yourself.
Yeah, so my name's Addison. I work at Penn Highlands Healthcare. I'm based out of the Du Bois campus, which is our main hub, and I am the student outreach coordinator. So some of the things I'm responsible for include setting students up, nursing students, PA students, nurse practitioner students, pharmacy, all the students with clinical rotations within our healthcare system. And that covers about 26 counties in PA so far. So we're happy to say it's more than half the state. So we have quite a big reach, but we try to place students wherever we can. And then I also go to high schools, middle schools, career and tech centers, colleges, just to inform people about what Penn Highlands is, what we do, our job opportunities, and our new student tuition scholarships that we partnered with some local schools.
Oh, and that's so awesome. And you're the perfect person to talk about in reference to the challenge program, obviously, because you work with lots of kids that are just getting into a college career, just getting out of high school. It sounds like you work with a lot of kids like that.
Yes, I cover a wide age range. I've been in middle schools, elementary schools, colleges. I even talked to some of the graduate medical students. So throughout their entire time searching and trying to explore healthcare careers.
Yeah, and that's so awesome that you even talk to like middle schoolers, because they might not even like realize that they have an interest in it, but then you give them that like oversight and you plant that idea in their head that they can think about it, and some of them might really find a passion for it.
Yeah, there's so many, I've even realized myself, there's so many different career paths within healthcare. And even I didn't know some of them existed. So the earlier we can introduce them to students, the better. It's just so they have a wider range of options and they know what's out there.
Yeah, a lot of the people that I know that are like in the medical field, a lot of them are like they get an itch for it from an earlier age. They either had like an amazing doctor, or they just had an experience where they were really inspired by somebody doing something in the medical field, and then they just end up finding like a deep passion for it.
Yes, and I will say the top two reasons I see that people are interested in getting into the healthcare field are either through a family member that's already a nurse or a doctor and they kind of followed their path, or television nowadays. Those Grey's Anatomy shows are huge, so a lot of students get inspired by those, but whatever gets them interested, we're happy to let them explore.
Yeah, the exposure is always important, even if it comes from something that's a little fake-ish, you know?
Yeah. Yes. Traumatized, but
yes, yeah. So tell us a little bit about Penn Highlands Healthcare. You guys said that you guys are pretty big and across a lot of Pennsylvania, which is really awesome. How long has Penn Highlands Healthcare existed?
Yeah, so we were founded on October 1st, 2011. So a little bit over a decade now we have under our belt. And since then, we've grown to have 8 hospitals, soon to be 9 when our State College Micro Hospital opens. And we have amounted close to 6,700 employees across our system. So we're happy to say each of our hospitals are the largest employer within their areas. And we're just happy to offer all those job opportunities, medical or non-medical, to those communities.
Yeah, and that's really awesome too that you guys have grown so much in such little time. You guys having over 6,000 employees in 10 years is honestly really impressive.
Yes, it's great. And everybody is wonderful no matter what campus you go to, whether it's at the hospital or we have a lot of, it's called our PHPN network. It stands for Penn Highlands Physician Network. So those are the outlying clinics, such as your family medicine doctors, rehabilitation centers, all of those, all the staff is great.
Yeah, and there is, I think that's an important thing that we like working with you guys in the aspect of like, there's a lot more opportunities than just being a nurse and a doctor as well. Like you guys obviously have a lot of IT. We even chit-chatted about that before the beginning of the show. You know, you have IT, front desk people, you have so many opportunities.
Yes, and like I said before, a lot of students, they think of nurse or doctor or the people that they see when they go to their family doctor, but there's so much more to healthcare, such as myself. I'm technically in human resources and recruitment. So opportunities like that where you don't think of right off the bat, but they are out there.
Yeah, and they're still very important because obviously there wouldn't be probably as big of like a staff pull in without having somebody like you who really goes out there and talks to people and really gets them interested in it all.
Yes, very much so. We have quite a few people in human resources. So without them, this place wouldn't run as smoothly as it does. So
Yeah, you got to have somebody to do the payroll and everything,
yes, these people need paid for their work.
Yes, absolutely. But that's really awesome. I think that that's a very big thing with Penn Highlands Healthcare is you guys seem to talk about that a lot as well, which is really nice. Just having opportunities to help people without having to be a nurse or a doctor. But obviously you guys love all of your nursing students and all of the hardworking doctors in the facilities as well.
Yes, definitely. Besides the patients who we care very much about, our employees, we're happy to help them, even if they want to start their education or continue their education while they're working for us part-time or casually. We're happy to help them in any way. For example, we have some that have started in our cafeterias and have worked their way up to be a nurse manager, so on one of our med-surg floors. So it's great seeing the growth of people, and they stay within their communities and around family and friends and stay within Penn Highlands.
Yeah, and that's huge too. Like that's really inspiring to hear that somebody can work a job that's like mostly unrelated to like direct medical assistance and build up to that point just because they love that field.
Yes, they definitely find a passion once they start becoming involved in the environment and they see the different things and they meet all these different sorts of employees and they hear a little tidbit about what they do and they think, maybe I could do that as well. And a lot of our employees have continued their education while staying here. So it's great to see.
Yeah, that is so awesome to hear. We always love seeing like opportunities evolve like that. So you have been working there for a little bit now. So we always like to ask, and that's a big part of this podcast, is just talking about some of the challenges that you face getting to where you are. So just personally, what do you feel like has been maybe one of your biggest challenges to overcome, or maybe one of the most important challenges that you had to overcome to get where you are?
Yeah, so I think personally, it was just finding while I was in college, just finding out what I was passionate about. I did not think I would end up in healthcare. I guess in a way I did. I wanted to be a pharmacist at first. But once you're in your classes and whatnot, and you start job shadowing and you think maybe it's not the best fit for me. But I knew I wanted to make an impact on people's lives or just in general. So I liked the idea of marketing. So I went to Penn State and got a degree in business administration with a focus in marketing. And I ended up right back in healthcare. And I realized I'm still making that impact, but I don't have to directly deal with patients or anything just because that wasn't just my passion. Very much grateful that there are people out there with that passion. But I just took a little different route. So that was probably my biggest challenge, just trying to figure out what I was passionate about and how to go about getting there.
Yeah, and that's so important because like you said, you started out wanting to be a pharmacist and just realized that wasn't going to work. And it's so crazy how you ended up in this position now.
Yes, and I'm very grateful that I met the people that I did along the way, and they helped me realize as well that marketing would be a great way to touch people's lives in a positive way.
Absolutely. You're preaching to the choir here. That's like my bread and butter is doing our marketing and having fun in that way. Yeah. But it's all to help students grow and evolve and meet amazing employers like you guys.
Yes, and it makes it fun too. It's a fun, I think, career to go down. You get to be creative. So I like it, especially with social media lately. I know you guys are really good at social media. So I think it's just fun and it still makes a difference. So.
Oh, yeah. And like you said, on top of helping the actual hospitals and facilities to grow, which is extremely important, but you help them find staff and everything like that. You also just get the opportunity to inspire kids, and maybe you might be a big inspiration for them to actually become a doctor and a nurse. They might just want to work in HR in the medical field. Like there's so many things that you can inspire them to do that they might not even realize is still making such a big impact.
Yes, and one of those ways I've realized is helping organize job shadows for these students because maybe they've heard of a job before, they hear one of our presentations and they think, I don't know what that does. And they get there and they love it. For example, we had one student, they didn't know what a midwife was, but they heard about what they do. And he said, that's what I'm doing. That's it. That's what I'm going to do. So he's currently in school trying to become a midwife right now.
That's so awesome too, because that is like
Yeah.
that's a much more niche thing that hospitals offer
Yeah.
and stuff like that.
Yeah, it was great. And it's fun to see the light bulb come on some students. You see them hear a certain word and they go, oh, okay, that's what I want to do. So
Yeah.
it's great to see. And I'm glad we get to be kind of like a stepping stone for that.
Yeah, and it's so important because you guys really allow, especially with job shadowing and stuff like that, that's very important to allow them to actually see what it's like and kind of, not directly be hands-on all the time, but get pretty close to being hands-on in a lot of situations.
Yes, definitely. It helps to get exposure just to see what their daily lives are like or a typical day, just because you see it on TV and you think you have an idea, but then when you get there, you think, oh, this is different in a good way, or this is maybe not what I want to do. I want to do something different within the healthcare field. So it's nice just to get the more exposure you have just to learn and kind of expand your horizons.
Yeah, that was an important thing that I never thought about because I wanted to be a programmer back in the day. And that's one of the things that actually made me realize I didn't want to do that as much is it's like so flashy and seeing the end results is so cool. But then I job shadowed one for a whole day. And sometimes when you do that, you realize what the actual days are like. And sometimes the flashiest parts of the job aren't always what you see all day.
Yes, definitely.
So that's super important. It's good that you guys show stuff like that because sometimes it's also the opposite. You like have in your mind what you think the middle of the day is like and you think it's so horrible or you think this or that. And then you go and job shadow and you're like, oh, wait, this is actually like really, they have very consistent, nice days and they do this that I didn't expect them to do. And I actually would really like that.
Yeah, and it's nice, especially with nurses, just because there are so many nurses, but there's different departments that they can go into and they all operate differently. For the most part, they're the same. Their ultimate goal is to take care of the patients the best they can and provide ultimate good care. But for example, you can be in the maternity unit and you're working with babies all day, or you can be in one of our nursing homes and working with geriatric patients. So even though there are nurses and they're both RNs, they have very different days. So it's nice to get to explore the different departments within those.
Yeah, and they might even envision that like only nurses work with old people or only nurses work in this certain situation, and seeing the different situations that they can actually interact in, they might realize that like, oh, I wouldn't like to do this all day, but if I was this kind of nurse, I would love my whole day. Like that would be perfect.
Yes, and some people like slower paced days and seeing the same patients, and other people like places like the ER where it's fast paced and things are happening all at once. So it's really nice that students can come in and we're able to offer job shadows again after these past 2 years and get the exposure to students that they need.
Yeah, that's so awesome. I know I always think about HR or the ER, the ER, because that is very crazy to me. I couldn't imagine like having a new patient and this whole rotation and like you're taking care of people so quick and everything's like so on the fly. That would be so much. That's definitely a certain personality that handles that well.
Yes, it's definitely, they do a great job and they all work as one cohesive team to provide the best care. So we're glad to have them. And we also have a trauma unit now as well. So they get to go in the helicopters and things like that. So it's very fast paced for those that like that kind of environment.
Oh, yes. Yeah. If you are a fast-paced personality, the ER will be a perfect area for you.
Yes, definitely. Yes.
So as you went on your like exploration in college and deciding like where you wanted to go and what you wanted to do, what kind of inspired you to get more deep into the healthcare field than just being like a pharmacist?
So when I was going into college and I was learning about all these things, I realized that ultimately the people that are making the decisions are the companies that can make the biggest difference with the environment, with anything really. So that's how I got mostly into marketing. And then I grew up in Du Bois, PA, which thankfully Penn Highlands, their main hub is here. So I've always been surrounded by it and I knew it was here. And it's one of the largest employers in the area. So it was kind of a no-brainer that I kind of wanted to pursue that. And I'm thankful that I saw a recruiting opportunity, and I thought it would be fun I'm not one of those to sit in the office all day. I do like majority of the time, but I do like getting out there and interacting with people. And this way, not only do I get to meet people within Penn Highlands, but I also get to go out into the community and do fun things like career fairs, or we just did a couple of parades at Clarion and Clearfield. So I get both the fun aspect and the part that is a little bit of paperwork, but it's worth it to get students in here. But yeah, I never planned to get into healthcare. It just kind of fell into my lap, and I'm very grateful it did.
That's so awesome, though. And that is like you got very lucky with your situation just being close to that. And I'm sure that as you were younger, you saw Penn Highlands actually form as well, since they're not like that old. So, that's a lot of luck just seeing that form and being right there for it. And it just kind of works out that it grabbed you.
Yeah, I remember being smaller, and it wasn't Penn Highlands at the time. And the rate that we grew, it's kind of incredible to see that you can see a company be successful and grow within your own hometown, because I always consider Du Bois small, but now that we have the hospital and things are expanding, it's nice to see an area that you love so much kind of grow with you.
Yeah, and your employees may be spread across all the hospitals and all of your facilities, but you guys have a large quantity of employees. And since that is kind of your main area, I'm sure a large quantity of those are concentrated there. Yeah,
definitely. It's neat too, because I get the privilege that I can go to the other campuses, the ones in St. Mary's, over to Altoona, or even down by Pittsburgh with Monongahela Valley and Connellsville. I have the opportunity to go there or work out of there and kind of see different areas, but all stay within the same company. So it's nice that I get that flexibility.
Yes, that's so awesome. So you obviously get to work with high school students, college students, and even elementary students, which I did not know about. So if you had to give a piece of advice for high school students facing challenges today, just in general, to help them to become successful people, find their way to college, find their way to the workforce, what piece of advice would you like to give to high school students to help them get through their junior, senior year and just get through the high school experience?
Yeah, I would just say be active, whether that be in your school or in your community. I would just say get involved in anything that you have a passion in. So if you like the theater and arts, I would get involved with that. It's a nice way to not only do something fun that you like, but also to blow off steam in case you are struggling in classes academically or anything. It's a nice outlet. Personally, I played tennis in high school, so it was a nice way to not only socialize with friends, but also it was nice to just kind of take your mind off of the academics of school at the moment. And there's some people, I know that a lot of people did community service or started their own businesses on the side. Mm-hmm. It's just a nice way to be involved in the community. And also it's great to put on your resume as well.
Yeah, and it's so important to socialize as well. So I think it is very important to be like involved, no matter if that's a club, sport, or anything like that, because it's so important to like have connections and have people to talk to, because you can kind of get experiences from other people as well. And so it just helps you to really get a rounded view.
Yeah, it's nice to have the foundation that you have that one thing in common with the person, but then you can also expand and meet new people that you never would have in the first place if they're outside of your school. So
yeah, and they might even be outside of your grade or anything like that. Yeah. And it might just be a person that you just would have never happened to talk to unless you played that sport or did that after school activity together.
Yeah, definitely.
That's so awesome. And then getting a little bit more specific as well, because you've seen a lot of high school students obviously go into college or work with you guys and slowly like get into the medical field. For any student that wants to get into the healthcare medical field, do you have any piece of advice for them either getting into a college program, working with you guys directly? Do you have any pieces of advice or something that might help them?
Yeah, so not to reiterate myself, but I would say job shadows and taking advantage of the clinical rotations would be the best if you want to get into the healthcare field, just because it gives you exposure to those different departments. Like I said, because there are RNs in almost every department, it doesn't mean they all operate the same way, whether it be hours or, like I said, if it's slow or fast-paced environment and who you're working with. So I would just have them or give them advice to take any chance to job shadow, even if they think they might be interested or they just want to give it a shot. Half a day even, just to get some sort of an idea of what happens every day. I think I would just tell them to make the most of that.
Yeah, I think that's an awesome piece of advice. And a lot of schools, like I even know my school required like to job shadow over the summer. And so most schools will give you either time off or excuse a certain amount of days for job shadowing and other stuff like that. So I think that there's a great opportunity there.
Yeah, and definitely, and it applies even if you don't want to get into the healthcare field. If you're just trying to go to school, or even if it's a career and tech center, to explore the different places and the different programs, or just job shadow or talk to somebody that's in that career field, just to see what it's like and kind of have all the information so you can pick and choose what you do with it.
Absolutely. Do you guys at like Penn Highlands Healthcare, do you guys do job shadowing?
Yes, we do. We have some places that are off limits just due to student and patient safety, but for the most part, we're pretty open, and a lot of our staff are happy to take students whenever.
Oh, and that's such an awesome opportunity. And that's definitely something to keep in mind as you guys expand, because you guys have more and more facilities. So you're accessible to more and more schools.
Yes, and it's nice for the students or the high school students or the middle school students, whoever it may be, that they think they want to get into nursing, but they don't know what it would be like, and they don't want to apply to a nursing program until they know they would like it. So a quick job shadow can kind of give them some foundation or groundwork to base their decisions off of.
So talking about high school a little bit, if there was anything that you feel like you took away from your high school career that you still do today, is there anything in high school that you found like very useful that you still use today?
I was trying to think. I think honestly, I know in high school, even at times I didn't like it, but working in groups and knowing how to work with others, it can be difficult at times in high school just because you're stressed out and you have other factors. But to learn how to work with others and how to communicate well with others, if you start early and understand how best to communicate with other people, especially people that aren't like you at all, it helps go into college or go into post-secondary school or even into the workplace right after school. It helps you connect with more people, especially in healthcare when you're taking care of patients or even working with other coworkers. It's nice to be able to know or have the tools to communicate effectively, especially with taking care of patients. We have a lot of teamwork within our healthcare system, across our campuses, within the departments, amongst nurses on the same floor. So it really boils down to being able to help the greater good. I would think, even though in high school it doesn't seem like the most fun thing to do if you're not put with your friends or anything, but it's nice to get that exposure and kind of build upon it and know how to communicate with people. Yes, in college, I took a public speaking class, and that definitely broke me. And I'm glad it did, because I could not do what I'm doing today. But it's nice just to have the confidence in communicating, because I did not have it in high school. So it definitely can come later in life, but I would have never thought I'd be doing what I'm doing now.
But I know for a lot of college students, it was not like that. And sometimes it is. You go in there and you don't realize like what it's going to be like, but you learn so much from it.
Yes, I know my college required a public speaking, but for any students out there that are going into college and they don't require it, I do always recommend that people take public speaking, because once you break it, you're good for the rest of your life.
Oh, yeah. Even if you're not going to be somebody like me and you that talks to a lot of people, just having the ability to talk in even a public facing space, like if you have a big group meeting at your company or something like that, it can even help with smaller groups like that, because it just helps you to feel a little bit more comfortable. Yeah,
and it helps, especially if you're taking a leadership role with team meetings or anything, like you said, smaller groups. It's nice to be able to communicate effectively and know that you're getting the right words across.
Yeah, and it's scary. Like it can be. It's very scary to like even talk to your peers. You know, you would think that wouldn't be very scary because you're all kind of like in a similar zone and you're doing similar jobs, but it still can be very scary.
Yes, definitely. So I'm glad I broke that, and anybody can do it. If I can do it, anybody can definitely do it.
And that's that's always encouraging, especially coming from you that like has to talk to a lot of people like that and everything. Knowing that you were so like scared about it, it does show you can get through it.
Yes, I remember I used to get sick before presentations or anything, but once I started, especially senior year of high school, you start doing more presentations and talking to more employers. It really breaks you out of your shell. And then college, I hit the ground running. So I'm very thankful they laid the groundwork there in high school.
Yes. So I do always like to ask, because most of the time I'm interviewing companies that work directly with the Challenge program, obviously. So I do want to ask, like, Penn Highlands Healthcare, what have you guys taken away so far working with the Challenge program? What has been your like favorite parts of working with us?
It's great seeing the direct interaction with students. Like I said, we always went to maybe career fairs and things like that, and you see a little bit of the student, but with the Challenge program, it allows us to keep going back and really keep cultivating those relationships with those students, and they start to recognize me, or they start to recognize the Hannah Danko that I work with. They start knowing the different things, like when we're coming in. For example, we were just at Brookville High School and we did the Business Partner Week, and the students that got picked won a gift card. And they were so excited about it. And the guidance counselor said they were so excited about it. And then I went in the week after and did mock interviews, and some of them were so excited to talk to me, or they're interested in healthcare and they heard our name and they knew we did the Business Partner Week. So it's nice just to keep seeing those students rather than just one and done or twice throughout the school year, which is nice because without the Challenge program, we wouldn't be able to keep going back in. So.
Yeah, that's a very important thing that we hear a lot, is like just us, I don't want to say pushing, but us facilitating that like connection more than just once in a while. It can really like help a lot, because obviously you guys are you are hugely busy trying to get employees from colleges, get employees through like high school interactions and everything like that. It can be very hard to like also have the time to facilitate all these connections with all these high schools and facilitate these events and seeing them so frequently.
Yes, and I will say one of my favorite parts so far, I'm fairly new to working with the Challenge program with Penn Highlands, but I did the fall kickoff assemblies, and some of the schools, they had their first round of students winning money. And I don't think the students knew it was for real until they opened up their envelopes and they saw the checks and they thought, they said, I don't have to put this towards something specific. We said, no, it's like your gift for doing well last school year. And it was nice to see the look on their faces when they thought, oh, this is real. This is like, I should take this seriously. Like, this is actually impacting my life. So it was great seeing that moment. And the students were so excited. And then they were talking about the next year, what they're going to do that year to hopefully be the next winner. So I'm excited to be a part of the senior class and see who wins that one.
Yeah, and that's so exciting for you, because obviously, as far as I can tell, you have plans to stick around for a pretty long time at Penn Highlands Healthcare. So it'll be exciting for you to like see that too over the years as well, because eventually those schools will start to get used to you and recognize you, and that'll be like so crazy to like see lots of these students go from like sophomores to juniors to seniors.
Yeah, I remember it was when I was a student, not too long ago, a high school student, I remember it being such a whirlwind and everything moves so fast. So it'll be nice that Penn Highlands, being one of their sponsors, will be a constant, and they'll know what to expect and they're excited about it. It's something fun for their school year.
Yeah, and it's funny that you said that about the $200 too, because that was a big thing that I had to learn, because I'm new to the Challenge program this year. And that was a funny thing that I had to learn, was I wasn't making a big enough deal about it. And so a lot of the time the kids would come up after and be like, so when do I get the $200? And I would be like, oh, it's like in the check, like the envelope that you're holding right now, it's in there. And so I started to like, what was that?
I think they thought we were joking when we said, okay, come up. And we handed them an envelope and they thought there was just a piece of paper in there. And they looked and they're like, oh, this is actual money. Like, I can get to the bank afterwards. Like $200 is a lot. I remember as a high school student, I had to work so many hours just to get $200. So that little bump, hopefully.
Yeah. But yeah, so I started making a bigger deal about it and like mentioning it more. And I slowly got like less and less questions because I feel like they've like realized that there was actually like a $200 check in there.
Yeah. Yeah, it's not just funny money or anything or monopoly money.
Yeah, it's not just like a promise that we'll give it to you eventually or something.
Yeah. Yeah.
And so finally, Penn Highlands Healthcare has been doing a lot, obviously, and they've been growing a ton. And so I just wanted to open the floor a little bit and see, like, is there anything exciting that you guys want to talk about? Because I know that it sounds like you guys are excited about a new hospital that might be opening. So is there any other things going on?
Yeah, so besides the new State College Micro Hospital, we're very excited. We have 2 hospitals near there that are already up and running, Tyrone and Huntington. But State College will be a little bit different. And I grew up going to State College, so it's a great area, and we're glad to break into that. But on a student level, we have been partnering with many career and tech centers and colleges to offer new tuition scholarships to students who are wanting to get into healthcare fields, become RNs or surgical technicians or medical assistants. We're happy to give some of these students a full ride so they don't have to pay us back. They just have to work for us for a couple of years after graduation, but that can be at any Penn Highlands facility. So if they live up in North Central PA where Du Bois is and they wish to go or try out Pittsburgh, they're more than welcome to. We have 2 campuses down there. But it's just fun that we are partnering with so many different organizations and offering that money just for financial help for these students that are passionate about helping others.
Yeah, and that's huge too that you guys are getting so big because like you said, that makes it so that they also aren't like needled into a single area. You guys are pretty spread out. So if they want to move away from their hometown or away from their college, they have a total opportunity to go to a different hospital or facility and continue to work there and get away a little bit.
Yeah, it's nice. You don't get many opportunities like that, I think, to be able to move into a bigger city, or if you want to be more rural or anything, and stay within the same company and do the same thing, rather than have to start all over brand new again. So it's nice that we have such a wide reach and we have so much flexibility.
Yeah, that is a huge thing. Like you said, I don't think that opportunity exists in many facets. And so that is so awesome that you guys offer that, especially with like the helping them through college and everything like that. That is so huge nowadays with how expensive everything can be.
Yeah, we recognize that a lot of people, one of the biggest barriers, I think, or obstacles to overcome whenever you want to get into healthcare field is the money to pay for school, especially if you want to become a nurse or a doctor or anything. So we're happy to offer this money and help them and guarantee them a job upon graduation so they don't have to worry about that either. We're just happy to help however we can, and hopefully students are interested and want to become these different groups.
Yeah, and I think those are literally the 2 most important things, is trying to find the funds for college and the fear of like the job opportunity after college as well. So you guys helping with both of those, it takes such an immense stress off of so many students probably.
Yes, that's definitely what we're aiming to do, and we're happy to help. We're happy that I think we have close to 7 different scholarships and partnerships now. So students are coming on board and they're getting their money and they're getting it while they're in school. So we recognize that you have to pay for semesters as they're happening. So we do pay for those as they're happening and not just a lump sum at the end, just to help the financial burden.
Yeah, and that's so helpful. And you guys partnering with the Challenge program obviously exposes even more students to all of your opportunities, which is so amazing as well. So I think that that's awesome that you guys are hitting students at pretty much every level.
Yeah, it's nice because some of these programs that we help with tuition for, some students have never even heard of these career paths before. Like I mentioned, the Surge Tech program, we partnered with Mount Aloysius College, and when I was in high school, I had never heard of a Surge Tech before, but hopefully with the Challenge program, we can expose these students more to what a Surge Tech is, what a normal day would be like, and how they would pay for it if they're interested in it. So
Yeah, just having so many more opportunities like that is so amazing.
Yeah.
Well, Addison, I know I have to let you go. So is there any other final thoughts or anything that you want to say to like the students and the kids going through high school and interested in healthcare field or anything like that?
Yeah, for anyone that's interested in maybe job shadowing Penn Highlands or just getting into a healthcare field or have questions about different paths and careers, they're more than welcome to contact me. I will give you my email address, and if you just want to put it in the description, that's really, I can help however we can. Or if I don't know the answer, I'm more than happy to find one of our recruiters that do know the answer to answer any questions that students may have about just their future in general.
Perfect. Well, thank you so much, Addison. I'm really excited that we get to work with you guys, and I know that we plan to work with you guys for a very long time, so it's very exciting. I want to thank you one more time, and I just want to say that I'm just so happy to have this opportunity to work with you all, and I think that it's really exciting.
Yes, thank you for working with us, the Challenge program. We're very excited to continue working with these students and then hopefully build upon that in the next coming years. So very excited to see what's going to be happening the rest of the school year.
Yes, amazing. Well, thank you so much, Addison.
Yeah, thank you.
And we're back. That was a great interview. I loved interviewing her. She was so wonderful. I loved the energy that she brought. She had so many good things to tell all the students. I was very wow, she had so much good advice. So first and foremost, I just wanted to say for anybody interested in Penn Highlands Healthcare after that interview, what should be all of you, they both have an Instagram, Penn Highlands Healthcare, and a Facebook, Penn Highlands Healthcare Careers and Penn Highlands Healthcare. And the Penn Highlands Healthcare Career Facebook page lists off a lot of their job openings, has more information about them, all kinds of stuff like that, so that you can do a little bit of research, see if there's any good opportunities there. And of course, all of her contact information will be below in the description for any of you interested in reaching out about job shadowing, interested in job and career opportunities there, or just any questions about Penn Highlands Healthcare in general. She said that she is very happy to talk to all of you and get you to the places that you need to be. So now, of course, as a closer, we just wanted to talk a little bit more about what the Challenge program has been doing lately. And of course, our big one is, if anybody's been paying attention for the majority of January, we've had lots of amazing giveaways so far. And of course, we have many more lined up for the rest of the year, which will be super exciting. Mel, I don't know if you wanted to comment on that at all, but I know that's been super fun for us, and we've given away lots of things already.
Yeah, I think so far this month in January, we've given out $1,000 worth in prizes.
Yes.
And we still have a bit more to give out through the end of the school year. So definitely follow us there. If you're not, stay tuned. You could win some gift cards. We've given away an Xbox and a Nintendo Switch before, so stay tuned.
Yeah, so make sure to keep your eyes on our Instagram. And of course, for fun information, we always have our Facebook, LinkedIn, all that stuff too. But
TikTok.
the Instagram. Oh yeah, TikTok. But our Instagram is where we usually host the giveaways and everything. So keep your eyes out on our Instagram if you want to do any of our giveaways. And finally, of course, we just want to remind you all to do Student of the Year. Keep your eye on that, because that will be closing at the beginning of March 1st. And of course, just keep your eye on the Challenge program, because spring assemblies will be coming up. We'll be coming back out to all of our schools to hand out those awards and have that exciting time with you all. And yeah, I think this was a great podcast episode. I was really excited to talk to Penn Highlands Healthcare. I really hope that they are with us for a very long time, because they're a great partner.
Yeah, there's a lot of opportunities with them because they're constantly growing and adding new facilities and things like that. So, and obviously, healthcare, we learned through the pandemic, is an essential, job. So it's a pretty safe career to have, in that sense that it's probably never going anywhere.
Absolutely. And I found out that they're just slightly younger than the challenge program, which I was like, that's so crazy that they've grown so much, even with being around less time than us.
Yeah.
So I hope to see them continue to grow like they have been, because if they continue to grow like they have been, I think that they will just be a wonderful company to be involved with. And now the ending of the first podcast of the year. Isn't that so exciting, Mel? We have a full year of podcasts coming up.
Yeah, there's lots more to come, so definitely stay tuned and let us know if there's anybody you want to hear from, whether it's a business partner or a school or students. Just let us know what you guys want to hear.
Yes. Thank you guys so much. Make sure to follow us on Instagram, TikTok, Facebook, and LinkedIn. Make sure to keep your eye on Instagram for all of our huge giveaways, and keep an eye on the challenge program as the year goes on, because of the spring assemblies, the student of the year, the Crystal Gala, and so much more. I want to thank you so much for listening. We appreciate every single one of our businesses and students, and we hope that you guys have an amazing day and night, and we will talk to you next time. Goodbye and have an amazing time.